Hey, we're going to bring Dr. Collier on, but let me sit up and just say this right here. Let me just get this all in. What you're not going to do is sit up here and disrespect. I work hard for my money, and if I go out to the Nike store and buy me a nice jogging suit, then I don't have to dress up. I'm not going to put on no damn tuxedo in the morning.
Well, you don't have to put on a tuxedo, though, but you just look like sherbet today. Something so bad.
I think you should post your outfit. Let everybody
check. Yeah, it's because baby, he looking some short beige, honey. I'm like, all right, honey, some short beige. I don't care if it's Yike, honey. It's still doggy. You're looking like some sherbet. And I thought to make that my color today, but I said, well, no, I don't want to offend him, so I said, let me just go ahead with my color.
Oh, y'all some mean people.
But he tried to dress it down with black, honey. It still didn't work.
I have on a black Nike bucket hat and a black shirt, Dr. Collier, and some black Nikes.
But Dr. Collier, honey, he's looking like sherbet, honey, and this is fall. So
I'm sure Rickey is working it because he is a fashion entrepreneur. You know, he's just a man dress-wise.
Thank you, sir. Dr. Collier, happy to have you this morning, despite the hate that's going on in the room this morning. Good morning. Happy to have you.
Good morning, Rickey. Once again, Rock T, Special K, Gary with the T. I'm glad to hear you in the conversation, Alfredas and the Brat. And thank you, Rickey, once again for the opportunity to bring healthcare information to the listeners of the Rickey Smiley Morning Show. So, Rickey, the listeners of the Rickey Smiley Morning Show have heard about the recommendations made last week by the current administration about no longer recommending or giving the hepatitis B vaccination at birth. Unless there's some small print that says unless the mother's been diagnosed with a current hepatitis B infection. But they're recommending to start it as late as age 1 month or later up to age 10, if at all, depending upon whether it's considered or if the person is asking for it. So, vaccinating babies at birth for hepatitis B has been scientifically proven to have great benefit, as have most vaccinations. You have heard me say that the vaccination process through the American public health system has been the greatest development in improving health of Americans and people around the world. Not just since I've been practicing medicine, but long before Dr. Collier. But this is what has changed the lives of Americans from many chronic diseases that affected people in childhood and negatively impacted their lives. So the U.S. recommended vaccinating all infants at birth with hepatitis B vaccine in 1991. So it's really relatively recent. Before then, around 18 to 20,000 children were infected by the virus by age 10, and about half of them at birth. So that means they were exposed to the mother's blood in either the birth canal or even when you get a C-section, you get exposed to blood, and that's when the baby would get infection. Of all those infected, 90% would develop chronic hepatitis B infections. Now, in an adult, they get hepatitis B, they get over it, it's kind of like the flu. They may test positive for it, but it does no long-term damage. There are people that would develop chronic hep B infections, but most people do get over it. But for a child with no immunity, 90% develop chronic hepatitis B. So you say, okay, what's the problem with that? Well, the problem is that it does long-term damage to the liver over the lifetime of the child, ultimately resulting in liver failure, liver cancer, and death. So this is a big problem. So hepatitis B is a viral infection that infects the hepatocytes or the liver cells. In a chronic infection, again, that damage happens over time. So it's not an immediately diagnosed disease state unless you're checking for it. So this infection is being spread by contact with blood or body fluids. That's why you're hearing that this is a sexually transmitted disease and that you don't need to get it until you're an adolescent or become sexually active. But there are other ways to get it, and children would get it from contacts in the home. They get it from daycare centers and schools. They could get it from a lot of places. So it's very important that they be protected from it. Since that has happened, the rates of hepatitis and chronic hepatitis B infections has gone to almost zero. The vaccine has been proven to be safe. Also, only 1 in 60,000 people have a reaction to it, and that's an allergic reaction. Even a severe allergic reaction like anaphylaxis can happen, but there's never been a single death associated with getting that vaccine. So that is a great vaccine. It is one that should remain, on the vaccine schedule, and one that Dr. Collier highly recommends getting it. And, it's one that also that health professionals get because, when I came along, I wasn't at the age in 1991 to have gotten it as a baby. But as a health professional, if you're exposed to the blood and body fluids, it's recommended that you get hepatitis B. So I did get it my first year of medical school. It was required to do that.
All right, let's go to the phone show with Dr. Collier. Good morning.
Good morning. I have a question about lymphedema. What is the best way to treat it?
Okay, lymphedema is a problem with the plumbing in the body. There's the arteries, there's the veins, and there's the lymphatic system. When blood goes through the arteries, the amount of fluid in there is reduced. It goes into the tissues, and as a fluid called lymph. The lymph circulation takes it all the way through the body back to the heart and mixes it back with the blood again. When there's dysfunction in that system, when there's obstruction in that system, when there's a problem, the fluid starts to build up, usually in the lower extremities, but it can happen in the arms, or oftentimes, particularly when they did mastectomies on women, and they would take their lymph nodes from under their arms as well. They would have lymphedema of the arm on the side where they had the breast cancer. So this is a problem. It's a you cannot cure it, but you can help control it. And most of the time, the major control is diuretics, water pills, if you will, and then some type of compression that closes the space and pushes the fluid back into the lymphatic system. So it is a chronic disease state. And amazingly enough, a lot of physical therapy places are now doing lymphedema therapy. So it's not something you're going to necessarily get at the doctor's office or in the hospital. But if a doctor can recommend lymphedema therapy, you can go to a physical therapist and they can help with that. But it's something you're going to have to deal with for the duration.
All right, you're on with Dr. Collier. Good morning.
I was told for the first time after taking several physicals that because I'm in my 60s now, I have kidney disease because I'm borderline. My numbers are borderline. So I'm, wondering how that happened and can anything be done to correct that?
Oh, absolutely. Chronic kidney disease is underdiagnosed, and it does happen that way. You get multiple physicals and everything is fine until it isn't. And all of a sudden, your number called your glomerular filtration rate, the rate at which your kidneys are filtering your blood and how efficiently the kidneys are filtering the blood, that number should be 60 or higher. When it is less than 60, you are diagnosed with what's called chronic kidney disease, stage 1, 2, 3, 4. 4 and 5 is when you're on dialysis, when you have complete kidney failure. But chronic kidney disease can be treated by treating its underlying causes: high blood pressure, diabetes, high cholesterol. The three disease states that Dr. Collier speaks of all the time are usually one of them or all of them in conjunction can cause that problem. The other thing, something really simple, Ricky, that I tell people all of the time, you have to make sure you're drinking enough water. So having chronic kidney disease is like driving a car with low oil. So it's low enough, but the check engine light hasn't come on yet, but you're doing damage to the engine on a cellular level, and you're doing damage to the kidney on a cellular level. Fortunately, the kidneys and the liver are the two organs in the body that can repair themselves if the damage is not too far along. So if you start to drink 8 to 10 glasses of water every day, not counting anything else that you're drinking, you have more fluid to filter, the rate of filtration goes up, so the GFR, the glomerular filtration rate, improves. So a simple and elegant solution that I find I'm recommending all day, every day to all the patients that I see, because nobody drinks enough water. Everybody thinks that they do, and there's no substitute for water. So you can't say, well, I drink coffee, or I drink tea, or I drink Coca-Cola, or anything. Whatever you're drinking, whenever you get something other than water to drink, also get a glass of water. If you finish your soda, you finish the glass of water. If you refill your glass of soda or tea, you refill the glass of water. And make sure that you drink it. When you go to a restaurant, first thing you do when they come up and ask you if you want appetizers, ask for water. I do. I ask for water for everyone at the table because if you don't order it first, you'll never get it when you go to the restaurant. So that's the best recommendation that I can do. Control those disease states and drink 8 to 10 glasses of water per day, every day.
Yeah, I'm drinking so much water I had to attach a hose pipe. Anyway, we'll be taking your phone calls. Get at me 8669 Ricky if you have any questions for Dr. MJ Collier. 8669 Ricky. Well, Brad, I really didn't have to attach a hose pipe, but I just went out.
All right, sir.
Brett.
Oh my God! Don't say me.
Brett.
What?
I really didn't have to attach the hose pipe.
Come on, Mr. Smiley.
Go to commercial.
You're doing so good.
Freedom.
You're doing so good.
I did, but I have to. Hey, we got the one and only Dr. MJ Collier on with us this morning. Let's get right to the phone because y'all been blowing the phone lines up. You on with Dr. Collier. Happy to have you.
I had a spinal fusion a year ago, and I actually hurt worse now than I did before the fusion, and I have some swelling in my back. Do we think that's from a failed fusion, or is there a CT myelogram need to be done to remove the fluid?
Okay, well, a CT or a myelogram would just be a diagnostic test, just a picture of the problem that you already have. So low back pain is such a complicated disease state, and surgery often does not result in resolution of pain. And also the imaging, a CT scan or an MRI, does not match the disease state. You can have perfectly normal x-rays and have severe pain. You can have substantive and significant disease, usually arthritis in the back, and no pain at all. So there's what's called discordance between those two things. Oftentimes when you have surgery, again, the healing process and the post-operative physical therapy is key. And the problem is most of us become very slack with that. We don't do it. Or you are doing it, and then all of a sudden your insurance says, we're no longer covering it. You must be healed for no apparent reason other than time has come and gone. So it is very important that you stay in contact with your operating physician, probably an orthopedic surgeon. Let them know that you're still having problems, and don't let them dismiss that complaint of pain, which is, unfortunately, there's no test that measures it other than you saying it. So say it with authority and enthusiasm. Work with your doctor. This is what's going to require a partnership between you and an orthopedist and possibly a neurologist as well, and then physical therapist. Physical therapy is so important, or chiropractic therapy, either and or all of those things will ultimately give you some relief.
All right, John, with Dr. Collier, good morning.
Yes, I'm starting a new regimen on Manjaro, and I just want to ask Dr. Collier, is Manjaro safe to take?
Oh, absolutely. Manjaro, which is one of the GLP-1s that are available, the two most common are Manjaro and Ozempic. The same exact drugs are available with a indication for strict weight loss as Wegovy and Zepbound. Wegovy also just got an indication for fatty liver, and it's the only one of the GLP-1s that has that indication, but I'm sure it's a class effect, and all of them can help improve liver function as well. So it is safe. You have to start low and go slow as far as titrating up to they used to try to get everybody to the maximum dose, and now they realize you only need to go to the highest dose that you can tolerate. That is also controlling your blood sugar, lowering your A1C, and helping you lose the weight. So greatest breakthrough in the history of medicine since I've been practicing. And if you see anybody that was overweight and now they're slim, that's what they're doing, despite what they're going to tell you. But finally, celebrities like Oprah came out and said they were using the GLP-1s versus counting points on a weight loss program. But for the weight loss that you get with that, one of the problems is that you can get loss of skin elasticity. And so one of the things that I recommend to all my patients now is the lipo drops. The lipo drops help prevent that as a side effect, and you don't get what's called the face of a GLP-1 that makes you look a little gaunt. So if you want to maintain your slim, trim sexiness, you also want to do something that's going to keep that skin tight and keep that muscle in your face.
All right, Dr. Collier, let everybody know how you can be reached.
Rickey, I can be reached on all social media at AskDrMJ. And tonight, YouTube Live, Facebook Live, Instagram Live. Ask Dr. MJ why? Because your health is important. The only interactive healthcare forum that allows you, the listener, to ask your healthcare questions. Again, I can be reached on all social media. Subscribe to my YouTube channel, AskDrMJ, Ask Dr. MJ, where we have hundreds of videos on various healthcare topics. Don't believe me, just watch. Okay. All right, these are the opinions of Dr. MJ Collier, not those of Rickey Smiley, the Rickey Smiley Morning Show cast, or his production crew. Thank you so much, Rickey, once again. Remember, it's time to get your 2025-26 flu shot. Next time you're at the pharmacy for any reason, just walk up and get it. No prescription is required. You are required to have a prescription for the current coronavirus vaccine, and one of the reasons that Dr. Collier wants to make you aware of, the current vaccine matches 2024 variants that are no longer around. So if you've had shots previously or you've had a coronavirus infection, you have immunity. So you make a personal choice about getting the newest vaccine. But the flu shot, always perfect match this time. Get it, and you'll have health for the next 3 to 6 months.
Okay, all right, y'all. More Rickey Smiley Morning Show coming up.